Hanta, if there ever was a viral illness that I didn't think I would be making a video about, it would be the hantavirus, because it's such a rare and obscure viral illness. However, since Gene Hackman's wife just passed from it and it's in the press right now, I figured it would be a good time to educate the community as to exactly what the hantavirus is, because I bet most people have never heard of it up until this very moment. The hantavirus was first identified in 1993 in the Four Corners area of the United States, in particular New Mexico. And it was due to the inhalation of infected viral particles in the feces and the urine of the deer mouse. Now, you could also get it by being bitten by the mouse. However, that's been an extremely rare occurrence. In fact, this whole viral illness is rare. There's only been 864 cases in the last 20 years. But there is some good news. The good news is there is no human-to-human spread. So the person who inhales the virus and gets the disease will not then contaminate the community nor their family. You get the hantavirus by the inhalation of viral particles from the feces or urine of this rodent. It's usually spread by sweeping the feces up in an enclosed area, be it an attic or a room or a garage. And all of these viral illnesses all started from the infected deer mouse, which is kind of good news because if you happen to have a rodent for a pet, be it a gerbil, a hamster, a guinea pig, or even that super cute capybara, you really don't have to worry. After exposure, you have a 1 to 8 week incubation period before you start showing your symptoms, which are usually like almost any other viral illness. You might get headaches, eye aches, fever, body aches. However, it's large muscle groups, so it's usually limited to the thighs, the back, and the pelvis. In about 3 to 4 days, you could progress into the Hantavirus Respiratory Syndrome, and that's 38% of the time fatal. When you develop that respiratory syndrome, you start to get fluid in the lung. That fluid in the lung alters your gas exchange, so you start to become short of breath as you become hypoxic or have low levels of oxygen. That might require mechanical ventilation and you'll be put on a ventilator. If it progresses to that, again, you have about a 38% chance of dying from the disease. Some patients will progress into a hemorrhagic renal failure. That's not quite as fatal, but it still is going to require some kind of dialysis until you get some renal recovery. The best way to avoid exposure would be if you happen to find mouse droppings in your house, to not simply sweep them up and create a dust, but to moisten them and get rid of them by scoop. Also, doing an ounce of prevention and trying to keep rodents out of the house by making sure you don't have any open air spaces. Unfortunately, there's no specific treatment for the hantavirus. It's supportive: IV therapy, antipyretics for fever, analgesics for body aches. We don't really have any specific antivirals, nor do we have a vaccine, and I wouldn't expect to see a vaccine because it's such a rare illness. I'm Dr. Messina, and I hope you learned something in this video. If you do happen to find mouse droppings around your house, to use some caution when cleaning it up. If you do like my videos, which are usually on aesthetics and medical issues, give me a thumbs up, hit the bell, click subscribe, and I'll see you at the next video.